Hello, Dr. Lewis here. You're a medical scientist with Health Revival Partners, your chronic disease prevention and reversal program, and Chief Science Officer of GoMD, your premier telehealth virtual care platform. And today we'll discuss coronavirus. What are the symptoms? This is an important topic because test kits aren't widely available yet. So you need to be able to assess your symptoms to see if you're in an urgent state and need to see a doctor or otherwise get bona fide medical advice. So let's dive into this. We're going to look at coronavirus symptoms and their variability. We're going to look at symptoms from the perspective of cold symptoms, flu symptoms, and COVID-19 symptoms and see where they overlap and where they overlap less so you can make some judgment about which you have. Symptom variability for COVID-19, and then a new case study published in the New England Journal of Medicine where they document the symptoms of the individual who actually had their condition reversed with the new drug. So let's dive into this. So here's one of several charts I'm going to show you that shows you the difference in symptoms between the cold, the flu, and the coronavirus. And the main one appears to be, just so you know, difficulty breathing, shortness of breath, which shows up here and less so in these others. So let's look at, from the early studies from China, the early data, what the major symptoms are for the coronavirus. These can potentially overlap, obviously, fever with the flu between the coronavirus, but here's what the largest preponderance of symptoms are. Fever first, dry cough, fatigue. You're not going to get a fever with a cold. Producing from the lungs, shortness of breath, and this is really a key one. It doesn't present immediately with the COVID-19 virus, but it does present where it doesn't show up in others. And you can see the other symptoms. Diarrhea is common both in the COVID-19 and in the flu. So here's symptoms when you look at a comparison report. So dry cough, the flu also has a dry cough. Fever, the flu also has fever. Runny nose, you'll see a little bit of runny nose in COVID-19, some in the flu, but much more in the cold. Sore throat, a lot of people are seeing sore throat in COVID-19, but much more in the cold. Now here's the key one, breathlessness, having a hard time breathing, having a hard time taking in air. And COVID-19 is really an outlier in this, whereas the flu and cold, you don't see these symptoms. So this is the key one to focus in on. Are you having trouble breathing? Headache, seen in flu and COVID-19. Body aches. We all know when you get the cold or the flu, you have body aches. So that's not really a good symptom to separate this as a COVID-19 symptom. Sneezing. Very little indication that's really a sign of the flu. Fatigue, all these diseases which are taking up immune system bandwidth, your body's working very hard, are going to make you fatigued. And then diarrhea, we're actually seeing the COVID-19 virus in stool samples, but the flu will also invade the gut and cause diarrhea, whereas this doesn't happen with colds. So let's look here. Here's another chart. It might be easier to read. So if we look at the things that are, yes, COVID-19, but not cold and flu, the only one that really shows up is shortness of breath. But we can see sometimes these other ones where aches and pains, sometimes common, So you can go down this list and see what your symptoms are and see how they line up with that for COVID-19, cold, or flu. And we always have the reference to these charts available on all our slides. So let's look at symptom variability, because even though people have these symptoms for COVID-19, they may not always occur, and they may not always occur right away. So understanding symptom variability will help you self-assess where you are in terms of what you have, in terms of if you're not feeling well. So the coronavirus is considered a slow burn. Patients tend to have symptoms for about a week before either getting better or getting really sick. So this Dr. Denson studied 15 to 20 of his patients with coronavirus and described this pathology, this escalation or de-escalation of the disease as starting slowly and then either getting better, rectifying, or getting worse. And according to this publication here, NBC News, other physicians are seeing similar progression. So this is kind of a typical progression here where you don't feel well, then you feel sick, then you get better. That's the cold. That's the flu in most cases. And we're seeing this with COVID-19 as well, except the differentiator is probably more people are getting really sick with COVID-19 compared to the flu. So sometimes patients start to feel better before their health quickly deteriorates. That's a differentiator. We're not seeing that in the flu generally or a cold. Once your body starts taking over and healing you, and you're starting to feel a little bit better, you generally will feel much, much better with time unless you really put yourself under a lot of stress, compromised your immune system, if you will. So looking at this article more, so within 20 to 24 hours, they got fevers, severe fatigue, and worsening cough, and more importantly, shortness of breath, which is the differentiating symptomology. So these are people that might have had mild symptoms, might have felt better, but then when it decayed quickly, and these are the symptoms, and then they get hospitalized. It's interesting to know that according to this study here on the cruise ship, where they tested over 3,000 people, 18% roughly, so between 15.5 and 20.2%, because not everybody was tested, had a positive test for the virus, SARS-CoV-2, underlying the disease, COVID-19, but were completely asymptomatic. So symptoms aren't always a reliable message that you have the virus. But in people that don't have symptoms, that's probably not a big deal unless suddenly their symptomology escalates. But these people, for the most part, their condition, they never erupted into disease, and basically their bodies took care of the disease on their own. So let's look at the new case study, The Symptoms, published in the New England Journal of Medicine. So here, the New England Journal of Medicine looks at the first case of the 2019 novel coronavirus, which is also known as the SARS-CoV-2. So this patient, who, by the way, rectified with treatment, had an initial persistent dry cough, a 2-day history of nausea and vomiting. And this is obviously when they came to the hospital and reported what was going on. So before they came to the hospital, they were feeling pretty poorly and had this. No shortness of breath or chest pain. And you can see from an earlier slide that only around 20% have this symptom, but it is a separate symptom for the COVID-19 disease. Vital signs normal. So blood pressure, respiratory rate, things of that nature. Even an EKG was normal. Had dry mucous membranes, but nothing else in terms of their total workup by the doctors at Mass General. Well, actually, I'm sorry, by the doctors at the Providence Healthcare System in Washington, where this case was studied and reported into the New England Journal of Medicine. So day 2 to 5 of hospitalization, which was day 6 through 9 of the onset of symptoms, vital signs still normal. Intermittent fevers, elevated heart rate, which is what tachycardia is, non-productive cough, loose bowel movements, and abnormal discomfort in the abdominal chamber, bloating, things of that nature. And this is not normal for a cold. And the stool tested positive for SARS-CoV-2. And obviously that's not a symptom, but just confirming that this individual was indeed positive. and it's not just getting into the respiratory tract, it's also getting into the stool, most likely through your mucus and then going into your gut as we breathe in the aerosol or micro droplets. So the important thing is, now that you have the symptoms under control and you can go back and look at these symptoms again and make your own decision, the key thing is, this is not an overly deadly virus unless you're immune compromised or have one or more chronic conditions, from cardiovascular disease to cancer. And so from having no health conditions at all to having cardiovascular disease increases your risk of dying from the virus by 1,200%, and most likely increases your risk of having severe symptoms by a similar, if not greater, margin. And we're all looking forward to treatments working across a broad population. But for example, in 2020, the current flu shot is only 58% effective. So resolving and rectifying these types of conditions really puts the odds in your favor, not in that of the virus. So we've developed a survey, a symptom survey, and here is the link to take it, to determine whether you have cold, flu, or COVID-19. Now, the key thing is, yes, even in our survey, there's no question we can't differentiate between all of the symptoms that may definitively imply COVID-19, but it's important that in the condition or the state we're in right now, where tests aren't widely available, this will at least give you a rough idea. And if you have severe symptoms, we give recommendations at the end of this survey about how to proceed, who to call, where you can get support. Do you need to go to an ER immediately? Are you in an urgent state, or are you in just a mild state where you can just quarantine yourself or maintain social distancing and things of that nature? So Dr. Tom Lewis here, looking at coronavirus. What are the symptoms? This is important because we don't have test kits for everybody. Matter of fact, a very small percentage of the population will get tested even in the next month or so. So we hopefully you found this information of value. We hope you take the assessment and become more empowered by learning more about your symptoms and how they relate to COVID-19. Thank you very much for your time. Bye for now.